And I want to thank you all for being here today. I know your morning started off in a real pleasant launch as people start to talk about what they're paying for their health insurance, healthcare insurance. One of the things I want to bring out, everybody talks about healthcare, the prices are going up, and healthcare insurance, the prices are going up. Taxpayers and hardworking Americans are all footing the bill. Before I got here, I was a car dealer, and we knew that insurance was an essential financial product. Now, no one could drive off the lot unless they had insurance on their car. And I think we're getting to the point where anybody in life today doesn't even want to get out of bed in the morning if you don't have some kind of health care insurance that's going to take care of you if something goes wrong. Now, the need for insurance it is more about the confidence that any illness or injury does not lead to a financial catastrophe. Now, affordable health insurance remains the cornerstone of competitive benefits package, serving as the primary driver for employee retention and the most crucial factor in a worker's decision to accept or stay with an employer. My son now operates our family dealerships. We started back in 1953, and over that time period, we've had thousands of people on our team from time to time, and we've always tried to do the best in their interest as far as products that would help them, not only while they're with us, but also when they retire, that there's something there for them as well. Now, when I was talking to Brendan yesterday, I said, you know, I haven't been following it as close as I should. What are we paying for our health care insurance right now? Because, yeah, we just got done talking to our agent. It's going to be $1.5 million this year. Now, $1.5 million used to be a lot of money. And to some people, it's not. To me, it's huge. Now, the average American family plan costs a total of $27,000 a year. Unless somebody says that's enough to buy a reasonably priced nice car, I would debate that with them. There are some easy fixes that Congress could enact to make health care more affordable, more transparent, and more valuable. And I have introduced legislation called Improving Seniors' Timely Access to Care Act with my colleague Susan Delvaney. Mr. Thompson, thanks for your comments, because that's exactly what we're talking about. This bill would make necessary reforms to prior authorization and Medicare Advantage. Lawmakers on both sides of the aisle, hundreds of health care organizations, and Americans from all corners of the country agree. Streamlining this process will allow our nation's seniors to receive the care they are entitled to more efficiently. This legislation modernizes the entire approval process to ensure seniors receive life-saving medical care that they have already earned. This bill has passed Ways and Means twice and has passed the House floor in previous Congresses. This bill has over 240 co-sponsors and numerous endorsements, including the endorsement of CVS Health. Now, Mr. Joyner, thank you. To our other panelists, I would like you to please look at this piece of legislation. If it makes sense to Mr. Joyner, you're all in the same business, it would probably make sense to you all too. So please take a look at that. We have a lot of support on this, but we can't get anything done until we actually get it done. Look, I don't know of another country in the world that spends more money on health care. And because of healthcare being expensive, healthcare insurance is expensive. I know in my own business, the more expensive product you drive, the more expensive the insurance is on that. The only thing is you can't leave the dealership without having insurance on that. What we really need, so when you heard about the piece that Mr. Joyner was on, I'd like you all to take a look at that and endorse it so we can put that on the floor again and get it passed and start making some progress in this. I want to thank you all for being here today. I know that at times, I witnessed years ago whenever Congress decided to bring the automakers in and criticize them very heavily because they flew in their own private jets. And they thought that anybody flying a private jet shouldn't be coming to Congress asking for taxpayers to support them. I think we've reached a point, if we can get by being political and talk about good policy. This isn't about President Trump, it's not about President Biden, it's not about President Obama, it's about the American people and having health care insurance that they can afford, and that they can get the health care they need when they need it without having to bankrupt themselves. So I would just ask you, please, you're in the business, and it is a business, and it's all math. When I look at the numbers, I say, these numbers look they're staggering. It looks like you're very profitable. I don't know what your net is. I know what the big figures look like. It's like, God, you had a hell of a year. I don't know what you netted out of it, though. So the only thing I'm asking you, and I think the whole committee's the same way, Let's make sure we're working together to get the right kind of health care insurance for the people that we represent every day. I do not represent 750,000 Republicans. I represent 750,000 Americans. They're looking to us to get with you and make sense of what the most expensive thing in their life is. Chairman, thank you.